यहाँ पे तो ये तो पूरा गांव है।
हाँ।
गांव में आरोग्य की थोड़ी बात करते हैं हम। तो यहाँ पे मोटापन वगैरह या मधुमेह जैसी बीमारी होती है क्या? क्योंकि इतने बढ़िया भाव में आप तो ट्रेकिंग वगैरह करते हैं, तो यहाँ पे कोई खान पान व्यायाम ये इसके ऊपर आपका कोई ध्यान होता है क्या?
ज्यादातर ऐसा बड़ी बीमारी तो नहीं दिखती, लेकिन मधुमेह जैसी थोड़ी बहुत हो जाते हैं। एक्चुअली हमारे यहाँ के जो लोग हैं, अभी खेती के सीजन चल रहा है, तो खेती में पूरे दिन काम करते हैं। हर सीजन में हर तरह का खेती का काम होता है। जैसे अभी खेती में चावल लगाने का काम है, उसके बाद चावल की कटाई होने का काम रहता है, फिर उसको दाना अलग करने का काम होता है, फिर उसको संभाल के रखने का काम होता है। मतलब पूरे साल में हर सीजन में अलग अलग तरीके से वो काम करते रहते हैं, तो इतनी बीमारी का प्रॉब्लम नहीं आता। लेकिन कभी बहुत सब लोग तो ऐसे नहीं होते कि किसी को कोई बीमारी नहीं है, थोड़े बहुत होते हैं। और आजू बाजू का जो दवा पानी जो होता है, जो पेड़ पौधे का, वही यूज करते थे हमारे पूर्वज भी। अभी फिलहाल अभी तो थोड़ा आरोग्य की चिंता लगती है, जो बड़े बड़े बीमारी आती है तो दवाखाना जो होता है, हॉस्पिटल होते हैं, वहाँ जाना पड़ता है।
अभी हमको रमेश भाव बता रहे थे कि ये जो पूरी परिकाष्ठा है, जैसे छोटे से गांव में है, हम बापू गांव के रमेश भाव है, वहाँ पे मोटापन की बीमारी, मधुमेह की बीमारी, रक्तदाब की बीमारी होने की संभावना बहुत कम रहती है, क्योंकि इनकी जो जीवन शैली है ये पूर्वजों से आई हुई एग्रेरियन जो बोलते हैं हमको, एग्रीकल्चर में रहते हैं लोग। यहाँ पे हम खेत देखेंगे, उनके घर के सामने या बाड़ी पे पेंटिंग बना रहे हैं, वहाँ पे खेत है, खेती बाड़ी करते हैं लोग, तो उनको खान पान पे नियंत्रण रहता है, उनका रोज व्यायाम होता है, तो उनको अच्छी एक 8 घंटे की नींद आती है। उनकी पूरी जो जीवन शैली है, ये जीवन शैली ठीक होने से उनको बीमारियों का संभावना कम रहती है। लेकिन जैसे ही उनकी अगली पीढ़ी आने लगती है, तो उनकी जो खेती बाड़ी करने कम होते हैं, वो परिकाष्ठा शिक्षण में लगा देते हैं, खान पान ज़्यादा होता है, और फिर वो सीरियलाइजेशन ज़्यादा होता है, तो उससे क्या होता है कि मधुमेह हो, चर्बी हो, इसकी बीमारी आने चालू हो जाता है। तो यहाँ पे भी ये प्रॉब्लम आती है। तो हमको देखना चाहिए कि जो हमारी यहाँ पे जो बड़ी समस्या है, जो चर्बी की समस्या है, और भारतवंश में जो चर्बी की समस्या है, इसको हम थिन फैट इंडियन बोलते हैं। यानी हमारी शरीर तक भी छोटी होगी तो भी हमारे शरीर में ज़्यादा चर्बी या मोटापा रहता है, इसको हम थिन फैट इंडियन होता है। और ये जो एक्स्ट्रा फैट होते हैं, हमारे यहाँ पे सूखा पड़ता था, पूर्वजों के टाइम सूखा पड़ता था, तो वो चर्बी का फैट बर्न हो जाता था, और उससे फिर हमको ऊर्जा मिलती थी शरीर के काम करने के लिए। तो ये एक्चुअली ये सालों से प्राचीन परंपरा से आया हुआ जो चर्बी या मोटापन है, ये भारतीयों में ज़्यादा है। इसलिए भारतवंश में मधुमेह का प्रमाण या रक्तदाब का प्रमाण या हृदय विकार का प्रमाण ज़्यादा होता है। और इसलिए खान पान पे ध्यान रखना, व्यायाम करना, हमारा योग, सूर्य नमस्कार करना, जैसे हमको योग के साथ जानते योग दिन है, योगी जी ने बताया है, जैसे योग करना, व्यायाम करना, खान पान पे ठीक रहना और वक्त पे सोना, ये सब काम से बहुत फर्क पड़ता है हमारे ओवरऑल जीवन शैली पे, मोटापन पे और मधुमेह पे। We all know that diseases which are non-communicable, whether they are mental health, whether they are diabetes, whether they are obesity, they are all generated here. And we all know that the mother of all diseases is obesity. Obesity has the ability to bankrupt our country, but it is through happiness, it is through health, we can change our health outcomes. And it is very, very important that we understand the relevance of extra fat. Extra fat is always hurtful and harmful at abnormal places in the body. It leads to diseases like blood pressure, it leads to diseases like hypertension, heart disease, depression. It also leads to diseases like type 2 diabetes. And if we are able to lose weight, and if we are able to stay healthy and happy, then we will go a long way in reversing various diseases, including diseases like fatty liver, including diseases like type 2 diabetes remission, and so on and so forth. इन्होंने ये कला, पारंपरिक कला, भारतवंश की कला जीवित रखी है और उनके साथ हमको ये कला सीखने का एक सौभाग्य मिला है, इसलिए हम उनको शुक्रगुजार हैं। ये इन्होंने हमारे जो कार्यक्रम है रंग दी लीला, इनमें उनका समावेश है और ये वारली के जो कला है वो कला को जीवित रखने में रमेश भाऊ जैसे लोगों का बहुत बड़ा एक योगदान है।
In this short video today, I'm going to talk to you about the consequences, the evaluation, and the management of obesity. And when we talk of consequences of obesity, we are conventionally talking about the metabolic problems associated with obesity. We talk about diabetes, hypertension, dyslipidemia, hyperuricemia, but that's not all. Today, obesity is also associated with other important problems, including the psychological problems, the mental problems associated with obesity, which I would say is often a bi-directional impact. A patient with obesity will often have depression, will often have problems related to stigma that is associated with obesity. But even when somebody is suffering from depression, would use food as a stress reliever and land up with obesity. So it's just not about the metabolic problems, it's also the psychological problems that are important. But another important aspect that is often overlooked in clinical practice is the mechanical issues associated with obesity. Today we talk of problems related to the joint pains, the osteoarthritis, the obstructive sleep apnea, the plantar fasciitis, and these are the different mechanical aspects associated with obesity. So yes, there are metabolic problems, there are mental problems, there are mechanical problems, and another very important aspect of obesity management is the mental problems, wherein we also talk about the monetary issues which are associated with obesity because it is a costly disease. The management is costly. The amount of investigations done costs a lot to the patient, and the medicines that are used are often costly. And obviously, bariatric surgery, which I would say is the king of management of morbid obesity, is an expensive affair in our country. So here we talked about the consequences of obesity, the 4 M's, the metabolic, the mental, the mechanical, and the monetary. So when we talk of the evaluation aspect of obesity, often it is important to try and find out the root cause of obesity. Today, we consider obesity as a disease. It's no longer considered as just a risk factor for other disorders. Today, when we talk of obesity, we have to find out why obesity is happening in that one particular patient. No longer we think that it's just because of eating more and walking less. I think there are 3 broad aspects that we need to find out in every patient who has obesity. And one, whether there is a problem with respect to metabolism, whether there is a problem with respect to the diet, or whether there is a problem with respect to energy expenditure. And I think what really helps in clinical practice is to sit with the patient and run through a routine daily schedule of that patient and find out where are the problems in that patient that can be improved to manage obesity. We no longer today think of obesity just as a mere number on the weighing scale, not even a number on the Inchy tape. But today we look at obesity as a much broader issue. And friends, if we have to evaluate obesity today, there are staging systems which are available that not only talk about the medical problems, looking at the mechanical problems, looking at the psychological problems. And I may have a patient who has a BMI of 43 without any comorbidities, may still be sitting in stage 1, and somebody with a BMI of 38 may land up at stage 4 just because they have severe osteoarthritis of the knee and they are unable to walk. So we look at obesity as a more broader aspect today. We look at the functionality of our patient, and we don't talk about just looking at the metabolic problems. So when I talk about the management of obesity, often we offer diet and exercise as the first step for management of obesity. But today we have newer medications which can help management of obesity. And when I talk of medicines, I would say there are 2 types of medicines that we're looking at. One, we're looking at the medicines which are used to treat comorbidities of obesity. These are the medicines which need to be weight friendly. For example, if I'm managing diabetes in a patient with obesity, I wouldn't like to use somebody who's on insulin or sulfonylureas, because these are the drugs that increase weight. I'd like to use newer drugs like GLP-1 analogs, SGLT2 inhibitors, or the conventional standard metformin in the highest dose, and try and reduce the blood glucose rather than giving any weight increasing drugs. Well, talking about weight management with the help of medicines, the future is really bright. We have drugs like GLP-1 analogs, which are helpful. They have shown in different clinical trials to reduce significant weight. These are increasingly becoming available. Very good data from phase 3 and phase 4 trials. Today, we have some of these drugs launched in India as well. And I'm sure that tomorrow, the way we manage diabetes today, we would be able to manage obesity as well with these drugs, with the help of these medicines, and treat obesity as well like a chronic disease. Right. So today, I'm going to give you a message for all those people who are struggling with their weight, how they should lose weight. And I'm going to leave you with just 5 simple messages that you can follow in your day-to-day life and reduce weight. And my first message to you is you should look at the food with respect to the macronutrients in the food. And it's important to increase your protein intake. When we talk of our Indian diets, whether we talk of North, South, West, or East Indian diets, we do eat very less protein. So it's important that we increase our protein intake to what is the normal recommended amount of protein. And having good amount of protein will give you more satiety, will help you lose weight. And that's my first message to you. The second important message that I'd leave you with is to try and find out the amount of oil that we use in our house. And what is usually, patients would come and tell me, doctor, we hardly eat any fried food. We hardly eat any oil. But when I actually ask them how much oil comes in the house for the number of people that are staying, it would be huge. So what is recommended is just to take about 500 ml of oil and other fat products per head per month. So if there are 4 people living in the house, I would say maximum 2 liters of oil, ghee, butter, or whatever kind of fat that comes into the house. The third important thing is about exercise. And what is really important about exercise is the regularity. I'm not saying that you have to walk 15,000, 20,000 steps every day. Well, if you are able to walk your 7,000, 8,000 or 10,000 steps every day, but you do it every day, but if you have your regularity in place, I think that will help for losing weight. The fourth important message for weight loss is to try and count your calories. Try and see how many calories are there in everything that you take. And today we have apps available on simple smartphones, free downloadable apps, and that would tell you the amount of calories that was present in one idli, a slice of bread, or a glass of milk. And that is helpful because if you are able to count your calories, you'll realize there's a certain amount of foods that you can take in large quantities, which are very low in calories, and certain other foods, which if you take little bit also would provide a lot of calories. And my last message for if you're trying to lose weight is important to be regular with your timings, your timing of sleep. It's important to have good sleep, eat your meals on time, avoid skipping meals, and that's also important for weight loss. So these are the 5 important messages that I leave you with. तो मुझे लगता है कि इंडिया में भी इसका हमें प्रचार करना चाहिए और ऐसे जो इनिशिएटिव्स हैं उससे डेफिनेटली बेटर होना चाहिए क्योंकि इतनी बड़ी आर्ट है, इतनी मेहनत का काम है और इतनी परंपरा है कि उसको देखना चाहिए।
हम लोग अभी इसको सहेज के रखे हुए हैं ताकि ये कला लुप्त ना हो।
आई थिंक हम डॉक्टर्स हैं, हम पेशेंट्स ट्रीट करते हैं, पर आई थिंक ये भी एक तरीके से सर्विस है। एंड बहुत अच्छा लगा आपका काम देख के, वेरी नाइस, बहुत अच्छा।